Welcome to another deep dive. You sent in a chapter on integrative geriatric nutrition, and we're ready to dig in.
Awesome.
Today, we're looking at how diet and lifestyle choices can impact our endocrine and metabolic health as we age.
And that's super important because it impacts everything from cardiovascular disease and thyroid issues to diabetes and obesity.
It really does paint a picture of how everything's connected.
It really is.
This chapter takes a really interesting approach to cardiovascular disease in older adults.
Absolutely.
Yeah.
It's not just about treating the symptoms you're seeing right now.
Right.
It's really about long-term risk reduction.
That makes sense.
So that changes how we think about medications.
Like statins.
Exactly like statins.
You would think that a medication would always be a good thing.
You would think that, yeah.
But this chapter challenges that.
Particularly for people over 80.
Right.
Who haven't had heart problems in the past.
So no history of cardiovascular disease.
Exactly.
Yeah.
The research actually suggests that in this group,
statins might not be that effective and might even cause more side effects.
That's a good point, and it just reinforces the idea that you always need to have those conversations with your doctor about the risks and benefits of any medication.
Absolutely. And, statins have even been linked to things like falls and frailty and depression in older adults.
Wow.
And they can even lead to nutrient deficiencies.
Wow, that's a whole other layer to it.
It's not just a simple decision.
No, it's not.
Now, speaking of specific concerns, let's zoom in on hypertension for a second.
Okay.
You've probably heard about keeping your weight in check and watching your sodium intake.
Right.
But here's where it gets interesting.
Okay.
The chapter goes into this whole thing about sea salt versus iodized salt.
Oh, I've always wondered about that.
So sea salt naturally has these trace minerals in it.
Okay.
While iodized salt has iodine added to it.
Okay.
Iodine's important for your thyroid.
Right.
But it doesn't have those extra minerals.
So just switching to sea salt might not be the answer.
That's a good reminder to check those labels carefully.
Yeah, for sure. And on that note, the chapter also points out that some medications for hypertension can actually deplete certain nutrients.
That's interesting.
So that's something else to chat with your doc about.
Yeah, if you're on those medications.
Absolutely. And if you're looking for dietary approaches to help manage hypertension, the DHH diet is a great place to start.
I've heard of that one.
Yeah, it's super well researched.
Yeah.
And focuses on those foods that naturally help lower your blood pressure.
So we've talked about lifestyle changes and medications, but what about the role our genes play?
Yes. The nature versus nurture debate.
Right. This chapter dives into how our genes, our environment, and gene expression all influence our risk for cardiovascular disease.
It's fascinating, right? Think of your genes as a blueprint.
Okay.
And your environment and your lifestyle are kind of like the contractors.
Okay.
They decide how that blueprint actually gets built.
I like that analogy.
And here's the kicker. Diet might be the most influential environmental factor.
Interesting.
When it comes to gene expression related to CVD.
So what we eat can actually change how our genes behave.
Pretty much.
That's wild.
And that's where this concept of bioindividuality comes in.
Okay.
You hear a lot these days, but it basically means there's no one-size-fits-all diet.
We're all unique.
We are.
Yeah.
What works for one person might not work for another.
Right.
It all depends on your own genetic makeup.
This makes me think of that Cantus study mentioned in the chapter.
Oh, yeah, that was a big one.
It showed that even in patients who are already taking statins, targeting inflammation, actually further reduced their risk of heart attack and stroke.
It was groundbreaking because it really solidified inflammation as a major player in atherosclerosis.
So inflammation is a really big deal.
Huge.
Yeah.
And the best part is that lifestyle interventions like that DAS diet we talked about can actually help reduce inflammation.
So these lifestyle changes can really make a difference.
They're more powerful than you think.
So understanding your individual risk factors, including those genetic predispositions, is key.
It's like having a personalized roadmap for your heart health.
That's a great way to put it.
And speaking of personalized roadmaps, this leads us to nutrigenomics.
Okay, I've heard that term before.
It's all about tailoring your diet to your specific genes.
So like a custom-made meal plan based on your DNA.
Exactly.
That's the future.
It is. And the chapter uses this gene called ApoE4 as an example.
Oh, okay.
Knowing if you have that gene
Yeah.
can really impact your dietary choices, especially when it comes to things like
what?
cardiovascular disease and even Alzheimer's.
Wow. So it's not just about our weight.
Nope.
It can impact our brain health too.
It's all connected, remember?
That's right. It is.
It even debunks that myth that coconut oil is good for everyone.
Oh, really?
Yeah, particularly for those with the ApoE4 gene.
So even foods we think of as healthy
Right.
might not be right for everyone.
It's about understanding what works for you.
That makes a lot of sense.
So nutrigenomics is all about moving away from those general recommendations and taking a more personalized approach.
That's really fascinating.
It's exciting to see where this field goes.
So we've talked about the heart, but what about another crucial player in our endocrine system?
The thyroid.
The thyroid, exactly.
The master gland.
Right. It influences our metabolism, our energy levels.
Pretty much everything.
And so much more.
Yeah, and this chapter points out that both overstimulating and understimulating the thyroid can cause problems.
That's interesting. So it's all about balance.
Exactly. It's about finding that sweet spot.
And it's also important to remember that thyroid disease might present differently as we age.
Right. It can be tricky to diagnose sometimes.
The chapter specifically talks about hypothyroidism.
With Hashimoto's thyroiditis being the most common subtype in the U.S.
And here's a connection I found really interesting.
Okay, what's that?
There seems to be a link between Hashimoto's and gluten sensitivity.
You know, I've heard that.
Have you?
Yeah, becoming more and more recognized.
So our food choices can actually affect our thyroid health.
It's incredible, right? What you eat can really impact how your body functions.
That's a powerful realization.
It is. And for mild cases of Hashimoto's, early intervention with diet and supplements might be enough.
So it's not always about jumping to medication right away.
Exactly. There are other options to explore.
On the flip side, there's hyperthyroidism.
Right, which is primarily caused by Graves' disease, another autoimmune condition.
Okay.
Now, it's less common in older adults.
Okay.
But it can still cause some serious problems like
what?
Heart rhythm abnormalities and bone loss.
Wow. So it's important to manage it.
Absolutely. And managing hyperthyroidism often involves addressing the increased metabolic demands on the body through diet.
So again, what we eat really matters.
It all comes back to that.
It does.
And here's something that's often overlooked.
What's
the connection between adrenal and thyroid imbalances?
Okay.
They often go hand in hand.
So you can't just treat one.
Right. If you're not addressing those potential adrenal issues, your thyroid treatment might not be as effective.
That's a good reminder that we need to look at the whole system.
Exactly.
Not just isolated parts.
The body is a complex web of interconnected systems.
It is. And speaking of intertwined health challenges...
Oh, yes.
Let's tackle type 2 diabetes and obesity.
Two big ones for sure.
I'm ready to dive in.
Let's do it.
We were just talking about type 2 diabetes and obesity.
Yeah, big challenges these days.
It's huge. And I was struck by this idea of malnutrition in the context of overnutrition.
It is kind of ironic, right?
It is. We have all this food available, but people are still lacking those essential nutrients.
Because they're filling up on empty calories.
Exactly. And we talk about diet and exercise.
The cornerstones.
But this chapter brought up another key factor for managing diabetes.
Oh, what's that?
Sleep.
Sleep. It's so crucial. But we often don't get enough.
No, we don't. And I never really thought about how it could impact blood sugar.
Well, it turns out sleep deprivation can actually lead to weight gain.
Oh, wow.
Throw off those metabolic hormones.
Right.
And even increase insulin resistance.
So we need to make sleep a priority.
Absolutely. It's not just about feeling rested.
Right.
It's about supporting healthy metabolic function.
And exercise can actually help with both sleep and insulin resistance.
It really is a wonder drug.
It is. I'm always amazed by how much exercise can improve.
Right. It's not just about losing weight.
No.
It impacts so many systems in the body.
It does. And let's shift gears to obesity.
Okay.
Especially in older adults.
A growing concern.
It is. And I like how the chapter encouraged us to shift our focus away from calorie counting and toward nutrient density.
Absolutely. It's about making those calories count.
Exactly. And get this, the chapter mentioned that being slightly overweight after 70
Oh, yeah.
might actually be linked to lower mortality.
Interesting, isn't it?
It is. It really challenges those old ideas.
It does those old paradigms about weight and health.
Especially as we get older.
For sure now, for those looking to manage obesity in later life.
Yeah. What are some practical tips?
The chapter suggests focusing on nutrient-rich whole foods.
Okay.
Instead of just restricting so-called bad foods.
That sounds a lot more sustainable.
Deprivation rarely works long-term.
No, it doesn't.
And combining regular exercise with a moderate reduction in calories can help you lose weight without feeling deprived.
That's the key, right? Finding that balance.
Exactly.
And that leads us perfectly into therapeutic diets.
Yes. A whole menu of options.
It is.
And the key takeaway here.
What's that?
There's no one right diet.
Of course.
It's about finding what works best for you,
That makes sense.
your individual needs and your preferences.
So let's start with intermittent fasting.
Okay, hot topic these days.
It is. What exactly is it and what are the benefits?
Well, it's less about what you eat
Okay.
and more about when you eat. It's all about cycling between periods of eating and voluntary fasting.
So like a schedule for eating.
Exactly. And research shows it can be effective for weight loss and improving insulin resistance.
But how does it actually work?
It's all about something called a metabolic switch.
A metabolic switch.
When you fast, your body uses up its stored carbohydrates.
Which is glycogen.
Exactly. And then it starts burning fat for fuel.
So it's like flipping a switch.
Pretty much.
And using fat for energy.
Yep. And that has a domino effect.
Okay. How so?
It improves insulin sensitivity, reduces inflammation.
Wow.
Even changes your gut microbiome.
So many benefits.
It's a powerful tool.
And then there's the ketogenic diet.
Keto.
Keto. I've heard of it.
It's everywhere.
But I'm a little fuzzy on the details.
No worries. So the ketogenic diet is all about
Yeah.
drastically reducing carbs
Okay.
and replacing them with healthy fats.
So lots of good fats.
This forces your body into ketosis.
Ketosis, remind me what that is again.
So ketosis is when your body starts using ketones for fuel
Okay.
instead of glucose.
And glucose comes from...
Carbohydrates.
So instead of running on carbs, you're running on fat.
Exactly.
That's pretty amazing.
It is, and it can be especially helpful for people with type 2 diabetes.
How so?
It can help stabilize blood sugar levels
Okay.
and improve insulin sensitivity.
And I remember the chapter mentioning that nutritional ketosis can provide an alternative fuel source
Exactly.
for those cells that have become resistant to insulin.
It's like giving them a new energy source.
That's a great analogy.
So yeah, keto can be a really powerful tool.
And then we have those more traditional approaches.
Like vegan and vegetarian diets.
They've been around a lot longer.
For sure, but they're still relevant.
And beneficial.
Absolutely, when they're well planned.
Right. It's all about getting those nutrients.
Exactly. Vegan and vegetarian diets tend to be lower in saturated fat and cholesterol.
Okay.
And higher in fiber, vitamins and minerals.
All the good stuff.
And that translates to a reduced risk of chronic diseases.
Like heart disease.
Yep, type 2 diabetes, even some types of cancer.
So many benefits.
There really are.
And of course, we can't forget the Mediterranean diet.
Ah, the gold standard.
It really is consistently ranked as one of the healthiest.
And it's not just about the food.
It's a lifestyle.
It's about enjoying meals with loved ones.
All right.
Taking your time, savoring the flavors.
Well, that's a whole way of life.
Exactly. And then there's the DSH diet.
Which is similar to the Mediterranean.
Very similar, but with a specific focus on lowering blood pressure.
So it's targeted.
Exactly. DSH stands for Dietary Approaches to Stop Hypertension.
Oh, I see.
And it's all about making those dietary changes.
So similar principles to the Mediterranean.
For sure, lots of fruits, vegetables, whole grains.
Revisiting those unhealthy fats.
It's about making those smart food choices.
We've covered so much ground.
We have.
From specific conditions to different dietary approaches.
But it all comes back to that connection, what we
ends.
eat and how we feel.
Exactly. And what about supplements?
Yes, the icing on the cake.
Are there any mention in the chapter that can support our endocrine and metabolic health?
There are a few, but remember,
Okay.
supplements should complement a healthy diet, not replace it.
They're not a magic bullet.
Exactly. Think of them as tools.
Tools in our arsenal.
So for cardiovascular health, we've got magnesium,
Okay.
coenzyme Q10 or CoQ10, folate, vitamin B12, vitamin D, potassium.
Wow. So many.
I know it can be overwhelming,
It can.
but each one plays a specific role.
Give me an example.
Well, magnesium is crucial for regulating blood pressure and muscle function,
Right.
while CoQ10 is a powerful antioxidant that protects your heart.
And I know omega-3 fatty acids are good for the heart, too.
Oh, absolutely. They have those anti-inflammatory benefits,
Okay.
which can reduce your risk of heart disease.
Now, what about for thyroid health?
Well, there's iodine,
Okay.
L-tyrosine, zinc, selenium, even turmeric.
And we need to remember those goitrogens we talked about.
Right, those foods that can mess with iodine uptake.
Especially if you have thyroid issues.
Absolutely now for diabetes management.
Okay.
We've got berberine,
Okay.
probiotics, cinnamon, magnesium, chromium,
And those can help with...
blood sugar control,
Okay.
improving insulin sensitivity,
Right.
reducing inflammation.
So many options.
There really are. And for obesity,
What about that?
we've got fiber chromium, MCT oil, fish oil,
And those can help with...
appetite control, boosting metabolism,
Okay.
and supporting healthy weight management.
But before starting any new supplement,
Absolutely. Talk to your doctor.
it's always best to get their guidance.
For sure, they can interact with medications
Right.
or have side effects.
So, safety first.
Always.
Are you ready to wrap things up?
I think so.
Let's move on to the final part.
Sounds good.
We'll distill some key takeaways
Okay.
and leave you with some food for thought.
Love it.
Welcome back. Wow, we covered so much.
I know, right?
My brain is full,
Mine too.
but in a good way.
In a good way.
It's amazing how much control we actually have over our health as we age.
It really is empowering, isn't it?
It is. It's like we've been given all these tools
Mm-hmm. A whole toolbar.
to support our
You
well-being.
just have to know how to use them.
Exactly. So let's try to distill some of the key takeaways.
Okay, good idea.
What really stood out to you from all this information?
I think one of the biggest things is understanding that
Yeah.
health concerns in older adults aren't just about treating symptoms.
Right.
It's about thinking long-term.
Thinking about the bigger picture.
Exactly. Making choices that support vitality.
And longevity.
Absolutely.
I think that really resonated with me too,
Yeah.
especially that part about medication use.
Oh, yeah.
We tend to think of medication as the automatic answer,
Mm-hmm. Mm-hmm. The quick fix.
but the risk-benefit calculation changes as we age.
Our bodies respond differently.
Like with statins,
Right.
they might be beneficial for some,
Yeah.
but for others, particularly those over 80 without any history of heart problems,
Yeah.
they might not be necessary.
And could even cause more harm than good.
Exactly, and it just emphasizes the importance of those lifestyle interventions.
Oh, absolutely.
Remember all those things we talked about?
Like what?
Managing hypertension,
Right.
reducing inflammation,
Mhm.
supporting thyroid health,
Yeah.
even managing metabolic issues.
Those everyday choices can make a world of difference.
And they're things we can all do.
Exactly. No matter your age or health status.
And I have to say, that whole concept of nutrigenomics
Oh, yeah.
blew my mind.
It's pretty wild.
It is the fact that our genes, our environment, and our food choices
They all interact.
do influence our health.
Incredibly.
And it reinforces that idea
Yeah.
that there's no one-size-fits-all approach to diet.
What works for one person
Might not work for another,
It's all about finding what works for you
based on your individual needs.
and your genetic predispositions.
And we explored so many different therapeutic diets,
We did.
each with its own benefits and considerations.
From intermittent fasting
Mhm.
and keto
Mhm.
to vegan, vegetarian, Mediterranean DAH.
There really is a whole world of options out there.
It's about finding what feels right for you
What feels sustainable.
and nourishing.
Exactly what nourishes your body and mind.
It's not about being perfect
No, it's about finding what works for you.
and making those choices consistently.
Well, I think we've covered just about everything.
I think so.
What a journey this deep dive has been.
It has.
It's really given me a lot to think about.
Me too.
But before we say goodbye,
Yeah.
what's one final thought you want to leave our listeners with?
I would say this.
Okay.
We've gained a lot of knowledge from this deep dive.
We have.
But remember, your journey is unique.
That's so important to remember.
It is listen to your body,
Mm-hmm.
honor your individual needs,
Right.
and don't be afraid to seek guidance.
From qualified healthcare professionals.
Exactly. They can help you personalize your approach.
So true. This is just the beginning of your journey
The first step.
to optimal health and well-being.
Keep learning. Keep exploring.
And keep those questions coming.
Exactly.
It's been such a pleasure diving into this chapter with you.
Likewise.
And to all our listeners out there,
Yeah.
thanks for joining us on this deep dive into integrative geriatric nutrition.
Until next time.
Stay curious and keep striving for a vibrant, healthy life.